Africa's AIDS program is in trouble. The health department's US partners here to get us back on track. We have the world's largest HIV AIDS treatment program in the world, and yet, despite the access to medication, many patients stop their treatment. A total of 4.5 million HIV-infected people are on lifelong antiretroviral treatment. As a result, life expectancy increased by almost 10 years in the space of 15. Over the same period, fewer people died due to HIV AIDS. Now, while there are several public and private contributors to AIDS programs, the government remains the biggest funder. The United States is also a big contributor through its PEPFAR program, giving $600 million this year alone. But many HIV AIDS patients are discontinuing their treatment. The US, which contributes billions against the fight, say there must be urgent intervention. Otherwise, President Cyril Ramaphosa's target of getting 2 million additional patients onto ARVs by 2020 won't be achieved. So why are they not taking this medication? Tonight we speak to US Global AIDS Coordinator, Ambassador Deborah Birx. On the line we have Dr. Jürgen Pillay, Deputy Director in the Department of Health. Very warm welcome, both of you.
Thank you.
Ambassador, what's the problem? Why are South Africans not taking this treatment?
Well, I really want to focus that it's not the clients. I want to say that up front because the clients are highly motivated. They're the ones that came forward to get diagnosed and to face that and confront their illness. And so they're doing the right things. They're coming to the health department. There are serious problems at the clinic. I mean, serious problems. So that when the clients come, they are waiting in very long queues. And sometimes they're told that they're disrespected. I think it's very important that we listen to the stories of the clients and we correct.
What do you mean disrespected? Is it still the status of it?
No, I think if they're a day or two late, the nurses or those attending often speak disrespectfully to them. And these are people who have come forward with what would be a deadly disease if they didn't take treatment. They understand they need treatment, but in South Africa's case, the need is so great, the queues are so long, the access is so limited that people can't lose a day of work every month. So we really need to make policy changes that are then implemented at the clinic level, things that we know that are working all over sub-Saharan Africa. Those have to come to Southern Africa, come to South Africa, and they know what needs to be done. We just need to do it in a snap way, or we'll never achieve the President's initiative. The President made that bold statement because that's the minimum that is needed to reverse the pandemic in South Africa. Putting 2 million more people on treatment to prevent transmission of the disease, but also for their own health, is so critical. We were excited when he made the announcement. We made a proposal to dramatically increase our funding to ensure that the President's goals could be released. But what happens at the highest levels of government has to come down to where the people are and everything that needs to be done to make this successful. And we've lost half a year to almost a year. We now have 18 months to achieve what the President said. So we have to put on thousands now.
You've got a lot of work to do. Jürgen Pillay, I mean, tell me about your experience of medication not getting to those who need it, and a little bit more about the reasoning behind it.
Well, there's usually kind of, two sides to a story, and I'm not talking just about HIV. There are patient-related factors as well as system-related factors. Now, the ambassador has spoken about some of the system-related factors, but let me move on to what we're doing about it. So we have, led by the minister and in discussion with the ambassador, a 10-point plan to address the issue of what we've called velocity follow-up. That is that patients, they get tested first, they initiate on treatment, and then they stop coming to the clinic for one reason or another. So one of the things we already have in place is a system of taking the meds to patients so that they don't have to come to the clinics as frequently. Now, one of the things we're going to be doing going forward is giving multi-month scripts, which means that patients really get, over a longer period, up to 3 months, get medication up to 3 months. So that decreases the burden on patients to come to the clinics, and also decreases the volume of patients at clinics. So we're also going to be focusing far more on support to patients, because one of the things we know about all chronic diseases, not just HIV, is that after a while, patients, of course, also suffer from fatigue of taking medication. So we need to provide additional support to patients, and we have, through our 54,000 community health workers, begun to mobilize them to support patients in communities in a much more robust way, as well as in a much more respectful way. maintaining, of course, confidentiality, because there is still a certain level of stigma around HIV as there is around TB.
Okay, well, I mean, it sounds smart. It seems that, Ambassador, that this is a way forward. And I suspect that when South Africans or when those who are suffering see the success of this, it'll encourage more people to go for treatment.
Yeah, and I think what Dr. Pillay just talked about, these actions that the Ministry of Health is taking and are now, the talking to the MECs, going to the clinic, ensuring that everything that he just talked about is translated into immediate action. Because every day, there's more and more infections every single year. So you're headed to 8 million HIV infections. We want to be a partner with the government, but also with the community to change the HIV pandemic in South Africa. It's possible. It's possible on paper. Now we need to translate it to action. I think what's happened over the last 10 days is extraordinary, but that needs to continue for the next 18 months in order for us to be successful together.
Okay, Dr. Pillay, I mean, what are you doing to put a stop to this? I mean, it's a staggering number of new infections.
So besides the treatment program, which also, if patients are virally suppressed, which means you can't detect the virus in the bloodstream, that's one way of preventing transmission. The others, of course, are well known. Using a condom consistently, having one partner, not multiple partners at the same time. Voluntary medical male circumcision is another. Pre-exposure prophylaxis, meaning taking a tablet if you are participating in high-risk sexual activity. These are all things we have in place, and they're beginning to show a reduction, but the reduction is too slow. So we really would like to call on communities to prevent HIV infections, as well as call on our staff at our facilities to be more patient with our patients, and sorry about the pun, and also provide respectful care in the way in which the ambassador just noted.
Okay, and what about training?
The training, the nurses and doctors know what to do. It's a matter of ensuring that they do it for every single client every single day. We are expecting the clients to stay on their medication, and we have to be welcoming, and we have to adjust to their lifestyle and make it possible. What's happening with the new infections, it's happening more and more in young people. Young people don't have hours to wait in queues. They need to get on with their lives. They have to work. So we have to fit into their lifestyle and make this convenient. And I think that's what this is all about, is to find a way. If we can find a way to reach 25-year-olds and 30-year-olds, it will set South Africa on a course for preventing any of the chronic diseases, because people will be used to coming to the clinic and see the clinic as their positive lifestyle and their positive health.
And obviously the relationship with you and the South African Health Department is working. Will the money keep coming from?
It's very much dependent on performance.
We need it.
Yes. Dependent on performance. So we really we believe that the president has made a bold initiative. When our president makes a bold initiative in the U.S., snap, snap, we run to where he is to assure that it's accomplished. I hope everybody in South Africa snaps and runs to what has really been put out by the president as a really critical initiative. 2 million more people on treatment within the next 18 months.
Dr. Pillay, briefly, if you will, what is it that you'd like to see happening in order to improve the situation here?
So we introduced a Welcome Back campaign in line with what the ambassador just said, and that kind of deals with two parts of the equation. The one is, of course, to welcome our patients back who started treatment or fell off the treatment bus for one reason or the other, which means working with our staff to make them more respectful and provide confidential care when patients come back. And the second is to encourage our patients to come back. It's very important for patients to continue their treatment, so we would really like them to come back to our facility.
Okay, let's leave it there. Dr. Jürgen Pillay, Ambassador Deborah Birx, thank you very much. Thank you. Sport coming up next with Ronald Masinda and the high-level sponsored killing of rhinos. We speak to someone who is getting one of the poaching kingpins to court.